Dr. Jonathan Tripp is joining us in studio. He's been testing his microphone over here.
That's right. I can't say testing 1, 2, 3. I had to choose different numbers.
Well, being a doctor with all that education, you could probably count up into the millions. So,
Oh wow! No, I still try to play myself as and not the rocket scientist, but the guy that'll listen and pay attention and use what I know. So
well, the doctor is in today because it's better health with Tripp Family Medicine. He's here until 9 o'clock this morning. It's 8:34:55, and Bill Colley with you as well. I'm handling the telephones for the doctor while he's in the studio. And if you'd like to reach us at News Radio 1310 KLIX and newsradio1310.com. A question, in fact, about our topic today. Some parents may have a question or two. Telephone number 736-0300, because children are going back to school, and that raises some medical issues too, doesn't it?
yep, we are. Our topic today is beating the back to school bugs, and boy, that happens every year going back to school. That people get sick, the kids get sick, they interact with each other at school, they bring it home. The little ones are going to daycare and they bring it home. Um, and so we're going to talk about some strategies as to how to reduce that because I know our office and most medical offices get a lot busier after people have been in school 2 or 4 weeks somewhere in that neighborhood.
It doesn't
So,
take long. In the fifth grade, I went back to school, and I came down with I've been healthy all summer, came down with such a bad cold. I had to go to the doctor, and I had to get a vitamin shot, of all things,
hmm,
and
I,
to try to break that.
I want to know what that vitamin shot is.
Yes.
Actually, there's a couple like B12 and B complex, and that might have been it because that is a boost to the immune system. So, I could bring up some supplement ideas with that. We've got school starting tomorrow for most of the Twin Falls area. Some of the other surrounding schools have already started. Time is of the essence, but a little bit of vitamin C. I prefer chewables. You can do some B vitamins that are helpful that way. But zinc is also a favorite. In fact, I don't want to plug a particular brand, but here's two that my mom loved the powdered packet called Emergency, and it's got a pretty good dose of vitamin C and B vitamins. There's also one called Airborne that's supposedly made by a teacher for teachers to keep them from getting sick. And that's pretty identical to the Emergency, except it has a little higher zinc level, which is also kind of antiviral and helpful that way. So those are some things that parents could do for themselves, for their children, without any real health threats. About the only time that I'd worry about those kind of supplements is if we knew we had poor kidney function, and that would be really rare. That'd be somebody who's born a kiddo that's born with only one kidney, and we know they have low function. But in general, those are pretty harmless and helpful. So those are some supplement things we can do. But we've got some other strategies we want to talk about too. But let me talk about things that are really common. What kind of illness are we going to see? The number one is what we call the common cold. Common cold is made of many viruses, not just one. Otherwise, we'd have a vaccine and nobody would get it. So the common cold are a set of symptoms. Sometimes fever, but usually a nasal congestion and a cough goes with it, and watery eyes, and sometimes body aches go along with it, a headache. So all of those are really quite common symptoms. And one thing that people don't know often until they walk in my office, and that is the first, it's actually about day 3 or 4 of a 10-day course of a cold that are usually the worst. So somebody will tough it out for about 2 days, and then they find out they're actually getting worse, and kind of in a panic, got to go to the doctor and find out, oh, I'm actually where I should be on this course. Um, if somebody's been struggling for a week and they're not getting better, that's about the time I say, it's time to see the doc. On the other hand, you got daycare and you have schools that say you can't come if you got a fever, if you're,
Hmm.
a sick kid, and that's a week's a long time to be out of school. So some other strategies for symptoms we can help you with. I can't get into all those details today, but the cold is one. Oh, the second for me would be the combination of nausea, vomiting, and diarrhea,
Hmm.
or what's called a viral gastroenteritis. And basically, your body's trying to shed stuff from both ends, and that's no fun, and you get dehydrated, and that's a bigger worry for kiddos than the common cold. Skin stuff, or we didn't even talk about bronchitis, but that's kind of an extension of the common cold that you actually can get into some respiratory troubles and a cough that just won't quit all night long. That makes the whole household miserable.
Hmm.
Um, Skin stuff. We have, in the old days, we talked about impetigo, which is still around. It usually is a strep based bacteria on the skin, looks like a little scab, but now also includes uh, resistant staph called MRSA or MRSA, which has become the most common skin infection in over about the last 10 or 12 years. So if you have an infected little ditzel on your skin or a spreading area of redness, it's likely going to be something related to this resistant staph.
Well, on to that thought for a moment. We've got more to touch on coming up in just a few minutes. Dr. Jonathan Tripp in studio with us. We're almost to 8:40. He's here until 9 o'clock this morning, 56 at the studio. And more coming up. Topic today, back to school and those bugs that your children encounter when they actually get back into the classroom. And we have room for your telephone calls too as well in the next segment of the program. Hope you can stick around. I was just telling the doctor during the break that my mother told me a story. She grew up in a small town in the northern Allegheny range and very small, 150 people. And still, I think they have a population of 150 people. And when she was a little girl, the cure for head lice was to wash people's hair in gasoline. That was the local remedy, which of course you didn't do near the wood stove because it could be much. Your problem, lice could get a lot worse if you actually, your hair caught fire in that
Yeah,
situation.
I thought you were going to say the cure was to shave heads because that's the Egyptian history is that they had wigs because the way they avoided lice was they shaved their heads and then they wore wigs. And I thought you were going to say shave heads, but if you doused your head in gasoline and then lit up a cigarette, it'd be the same effect.
Yeah,
Yeah,
it's just deadly. So
kill
luckily
kill
we don't
kills.
use the remedies like
Yeah,
that any
yeah. The
longer.
lice are a little less threatening than the gasoline, but no. So we've got lots of remedies. In fact, lice is one of the issues from school, and lots of people. Traditionally, anybody with lice must be terribly dirty, must not clean, must not, take care of themselves. But the truth is, it takes one exposure to somebody at close proximity that has it, and you, the super ultra clean freak house, now have lice in your house and get to go through all the same, humiliation and cleaning techniques and clearing out the house and the bedding and the carpets and everything. So lice is a real problem. It is pervasive. It is easy to catch. So the best recommendations I can say to tell your kids is don't borrow somebody else's brush. Don't wear somebody else's hat. Those are some areas that are pretty easy to avoid. But the truth is standing next to somebody with lice usually isn't the problem. You have to be pretty darn close, almost a wrestling match, to get it by being near them. Um, so, fleas is another, but usually that has to do more with the animals contaminating our living spaces. Scabies is another. Scabies is one that really does just take kind of being in the same household, often kids that sleep in the same bed or others, uh, and it has traditionally been thought of as a sexually contacted disease, but it really, I've seen more scabies on kids than any adult that I've ever seen, and it's easy to treat. It is sure itchy, and boy, it's tough to clean the whole house. So those are some areas that little motivation to say, you know what, let's make sure we're not sharing hats and
Conjunctivitis was common too when I was in school.
yeah, good old pink eye is very super contagious. You have somebody with pink eye, they put their hand on their eyes and then they put it on a desk or they put it on a doorknob. You touch that same space and then rub your eye later without washing your hands, and you get pink eye. I get it about 3 times a year just thanks to the medical practice that I'm in. So I'm real. Anytime somebody comes in with pink eye, the whole office gets wiped down, and it's as if they brought in Ebola. We are definitely trying to clear out the office anytime somebody comes in with pink eye.
You mentioned wiping the office down. So there are obviously ways to limit exposure and maybe even, to work toward prevention.
Yeah, most of these illnesses, colds, the nausea, vomiting, diarrhea, pink eye, uh, Most of this can be avoided simply by A, washing our hands before we eat or touch our face. That's probably the one thing that kept me out of being ill when I worked emergency room, where I saw a lot of these common illnesses. And boy, I don't want to go home and have, 2 or 3 days of throwing up and diarrhea that I can't hardly stand because I'm so sick. So almost a little paranoia about wash your hands just before you eat. It keeps you pretty darn healthy. So that's one strategy. But as far as surfaces go, a lot of the wipes that we use now, whether they have bleach in them or not, are quite effective at killing microbes, which are viruses, bacteria, even fungus. So whether you wipe the doorknobs down, the table surfaces, the desks, one example is like in schools, wrestlers are famous for getting what's called MRSA or MRSA. It's a resistant staph infection. And the single best thing that can be done is that the mats that they practice on, play on, get wiped down every time. They get some type of an antibacterial cleaning agent, and I know our schools are going to great lengths to try to avoid this. Locker rooms and wrestling mats, and probably even desks and doors in our janitorial crews. So I think the schools are making a great effort to try to help us out, but there's some things we can do just by simply washing our hands before we eat.
And in wrestling, I can recall when I was a kid in school, we went from the mats that were stuffed with like a cloth covering to a more of a foam mat that had more of a sheen on the top, so it's much easier to clean afterward.
Yeah, it's a non-porous seal that allows things to be cleaned quite well. And so the question, in fact, I often see a wrestler that has, a skin infection, and the rules are pretty stringent that, you don't get to wrestle, you don't get to practice until you have complete clearing of that skin, and that's often a couple of weeks.
Dr. Jonathan Tripp in studio with us this morning. We're about 10 minutes away from 9 o'clock, 56, and you're listening, of course, to Better Health. 1310, News Radio 1310 KLIX, News Radio 1310.com. You can reach our show at 736-0300, 736-0300. And again, the schools themselves have gone out of the way, I think, because of the changes in things like a wrestling mat, updating the equipment they use. When we were in school, we were told you got to start laundering your football equipment, and we had all of these changes that were made, and I think the idea was if you're going to have clean clothes on, clean equipment, you're going to be in a lot better shape come the end of the season.
It is amazing. It's just things that you would think would be common sense, but of course now we're talking about 14 and 15-year-olds that, common sense is still kind of out there. Discussing showering more than once a week and things like that are really helpful in keeping our bodies clean, reducing bacterial loads. But I'm not suggesting antibacterial soaps. In fact, we found that that was kind of a bad move. About 10 years ago, it was really a big deal to have antimicrobial soap. And most of that has proven to just treat the easy to treat bugs and keep the harder ones around. So mainly just the act of cleaning with mild soap and water does great things for the body and reduces bacterial loads pretty effectively, and as well as cleaning clothes, equipment. Um, Another technique that is relatively new, I mean, I guess I can't say it's new, but relatively not well understood or not practiced well. We shake hands as part of our cultural tradition. Great way to spread disease. I'm not suggesting we stop shaking hands. That will make you, kind of a social outcast in our culture. But the act of sneezing or coughing used to be cover your mouth with your hand. And then you go ahead and shake somebody's hand and you've just spread everything you could. So changing that to sneezing or coughing into your elbow, you actually lift up your arm and turn your head into your elbow, especially if you have a long sleeve shirt. There's an absorption by the shirt of the droplets that otherwise would be spread in the air to catch colds, bronchitis, things like that. So I found that's very helpful. The military uses it in a pretty heavy way. I've seen little kids that have been trained by their parents to do this, and I'm amazed at how second nature it becomes. Rather
Mm-hmm.
than cover your mouth, honey, as you cough into your elbow. And sure enough, I watched a whole family that had a cold, and they were doing that in my office, and I thought that family is actually doing better than the average American to avoid spreading it to other people. So that's a strategy to help. stop spreading it to others.
8:52, and I believe we have a telephone caller with us, and you're on the air on Better Health with Tripp Family Medicine and Dr. Jonathan Tripp.
Hi there, this is Eva Craner and Bill Brulot from the Twin Falls School District.
Good morning.
Yeah, welcome. We'd love to hear your input on what the schools are doing.
Well, we were just listening to you talk about coughing into your elbow. Some of our teachers call that the vampire cough because you're pulling your cloak around and you look like a vampire when you're coughing. So that's a fun way we've gotten some of our kids to practice that and stop spreading germs.
That'll be great. The Twilight series will appreciate that input.
Yes.
No, tell us what else you do at the school in general, to try to avoid that. What I may have mentioned some of those things already.
Dr. Tripp, I think you've mentioned a lot of it already. A lot of it is preventative, where we try to teach the kids what to do when they have to cough or if they're not feeling good. The other part we really stress to parents is we like to have kids, if they're sick, out until they have 24 hours of no medicine and no fever over 100 degrees, and that's according to CDC regulations.
I like that. That sounds a lot like what I tell my patients in my office.
Yep. And so lots of parents might see Lysol wipes or antibacterial wipes on their student supply list this year, and that's for teachers to have those supplies to wipe down those desks and help stop the spread of disease and infection.
Is there a bit of coaching that goes on, I think sometimes with the parents, just to say, this is the new approach and this is why, because I think at this day and age you almost have to explain everything to everyone.
Yes, we really do. We have to explain to them why we're trying to do certain things to keep everybody healthy as an entire society, especially where the kids are together in a group of 25 to 30 kids all at one setting, and they're going in and out of classrooms, of how we are all working together to keep everybody healthy. We try to send home some flyers, especially when the cold season first appears, and let the parents know what's going on in that realm and how they can help, and teach their kids how to do the cough into your sleeve or into your elbow, and train parents as well as the kids, like, oh, that's the new thing. And honestly, after we train the kids, a lot of times they do a great job going home and looking at their parents and saying, you didn't sneeze into your elbow.
Yeah, I've had training like that for my children. That's
some really basic things that parents can do to help their students too is, make sure they have a nutritional breakfast. Make sure they get a good night's sleep. Those are great things to help build the immune system. And we provide a nutritional breakfast and lunch at all of our schools. So we really try to assist in that way. But that coordination with the parents really helps.
Well, I cannot emphasize the breakfast idea enough. It plays both into the physical function of the body, and you are much more likely to get ill when you're skipping breakfast, as well as the mental function, the intellectual function. I just can't hardly understand how a kid that skips breakfast functions for the first half of the day till they get to lunch and expect them to do well in their academics.
I always look at it and tell kids that having breakfast is a win-win situation. It keeps you healthy and it makes it available so that kids can learn.
Well, and I'm thinking of my own children, if they went without food for very long, we have a term at our house we use. It's called they're hangry. It's a combination of being hungry and angry. And boy, I would think little tiffs at school would be a lot more frequent if you're skipping breakfast.
Exactly. Dr. Tripp, would you go back a little bit and explain for those listening about head lice and how they can clean it up in their house? Because that is prevalent in our society in this day and age.
Well, the head lice also have a lot of resistance. So there are treatments that are common. Permethrin is the generic name for most of the medicines we use, and they work about 80 to 85% of the time. So it's important that your healthcare provider be involved, especially if it doesn't work after one treatment. But the idea is you treat immediately, and then about a week later for anything that else might have incubated that you didn't catch. For the head and the hair, it's mainly a shampoo and then a fine comb that helps take out what they call the nits or the egg shells out of the hair. That helps you cosmetically look a lot better as well, to not have a bunch of little white things in your hair. But at home, it is a combination of cleaning all the bedding, if you can, the upholstery itself, all at one time. So you do the treatment with the shampoo, You sleep with it sometimes overnight, depending on the treatment. But that next day is a cleaning day where every bit of linen, pillowcases, sheets, bedding all go into this. And the permethrin, it comes available in a spray that you can spray upholstery that is, not leather, but carpets can be done that way. It can even go to the extent where you bomb the house, and that's quite a process.
We'd like to thank the good folks from the Twin Falls School District for joining us this morning on the program, and some great input as well coming from them. Quickly, Doctor, before we wrap up today, for people who'd like to get in touch with the office, how do they go about doing that?
Yeah, our phone number is 208-933-4400, and our website is trippfamilymedicine.com. And Facebook is also at Tripp Family Medicine. So phone number is probably the easiest, 933-4400.
And welcoming new patients.
And welcoming new patients. And we have a new physician assistant that we got to wait a month or so before he shows up. And we have two half days a week nurse practitioner who will be joining us in about 3 weeks. So growth is on the way. And if you know an awesome nurse or LPN, we'd love to talk to them. We need more of those.
9 o'clock news straight ahead from Fox.